But there are enrollment periods with Medicare, and from October 15th to December 7th is called the annual election period. That's when people make changes to their Part C and Part D plans. The reason I brought that up is because a lot of these changes were activated and put into place in that last quarter, because anything you do in that last quarter becomes effective January 1st, 2021. So that's where we are. So a lot of these changes have happened over the last quarter, but they didn't take effect until this month. So let me get to the next slide here. So here's a few changes you may not have heard of. Medicare coverage of innovative technology. What is that? What does that mean? Now, I left up a copy and paste. Where did I get my information? I always let everybody know my information comes from cms.gov. There's medicare.gov, and medicare.gov is where you go to learn about plans and you can put in your prescriptions. But like I had said before, if you have never navigated that site, I want to say it's people friendly. It's it can be overwhelming for sure, because there's a lot of information, and if you click the wrong tab, you got to get back to where you were. So we never see Medicare as a do-it-yourself kind of thing. I know right now a lot of people are on DIYs, because what are we doing? We're at home. And what are we doing at home? We're doing arts and crafts, right? Or we're just learning how to build a shed in the backyard, whatever, or home gardening, right? We're all doing these do-it-yourself kind of things. But when it comes to healthcare, we want you to do it. We want to do it with you. And so when you go to medicare.gov, there's a lot of information. There's a lot of tabs to click on. And so we'd love for you to have an expert walk you through that, understand it. But when it comes to information, I go to cms.gov. And then from cms.gov, there's certain fact pages and newsrooms and regulations. Again, it's a very deep site to get into. It's like its own little Google if you think about it. But that's where I get my sources. So I'm telling you that so you know I got it from somewhere, and these are copy and paste. So I left it up for you to read as I talk about it. Now, Medicare coverage of innovative technology. This is really a huge thing. So CMS stands for Medicare Medicaid Services. And what it's saying is that at one time, and let me go to the next slide, and I might go back to this one. So whenever someone came in under Medicare and they were diagnosed with something, the FDA always had to say, well, hold on, we need to make sure that this procedure has been tested, that this mechanism, let me go backward. This thing has been trialed more than once, okay? And so when that happens, there's a delay in healthcare. There's a delay in maybe preventing you sinking further into that condition, or sinking further into more sickness or longer treatment. And so let me go back to the very first slide. So what Medicare has done was it put in action that would allow a pathway, and I'm going to read just straight on. It says it will help smooth the Medicare coverage pathway for innovative products, resulting in faster access to new devices for America's seniors. And now, if you're under 65 and on Medicare, you're part of that group, even though you're not a senior. This just is, Medicare is typically for 65-year-olds and up, but we are including if you're under 65 and you're on Medicare. Now, it's part of the Red Paper Reduction Act. And this is part of that act, how this is allowing this stuff to be approved in same day. So if you look at it, if a manufacturer has opted into this MCIT, which is under the Medicare thing, then the start date for coverage, it can happen same day, and it can last for up to 2 years. Same day. Now, the breakthrough device designation is only given to devices that meet specific criteria, and that's going to fall under the Century Cures Act. And we know this was just passed over the summer. So I'm so glad to see that things that were passed over the summer because of COVID or coronavirus, I'm so glad that those initiatives that were happening included the Medicare population, and this is one of them. So for beneficiaries impacted by these diseases, it will provide assurance that they will have access to the latest breakthrough medical devices to treat the condition. provided that Medicare has a benefit category. We know everything is under a code. Um, and so these devices will be on the CMS website. So what does this mean to you guys? Why is this important? Because a lot of people were under group health plans and they felt like if they were going to this hospital or they had that plan or they had this doctor, that they weren't going to be treated, I guess, equitably in their health care. And so if you go over here, you're not going to get the same kind of treatment. Let's just say for Houston. In Houston, we have one hospital that is at the pillar of cancer treatment, right? And everybody's heard of this hospital and they're like, oh, if I get cancer, I'm going there. Well, with this kind of action taking place of equitable treatment, then that's saying that you can go to any hospital and get the same treatment at this hospital that you would at that hospital. So it kind of levels the playing field. And regardless of which Medicare plan you are in, that's a big deal. If you're in a Medicare supplement or a Medicare Advantage, if it's on the CMS website as breakthrough technology, then your plan is going to cover it. And if you don't know the difference between the Medicare supplement plans and the Medicare Advantage plans, that's okay, because we have experts available to help you understand, because now the playing field is even more equal across the board. And the greatest thing is that you can tell your doctor how you want to be treated if you've heard of something or you're aware of something with your condition. If it's on the CMS website to be approved, if that vendor has opted into the MCIT, and I promise a lot will because of this, then you're going to be able to get that latest treatment. And that is what is exciting. If you have ever helped somebody in Medicare, maybe a parent or an aunt or whatever, it seemed like a lot of work to get something done, right? Again, nodding y'all's heads. I'm nodding my head because I've helped my grandmother with her Medicare. I've helped my great aunts with their Medicare, my aunts and my mother. I mean, I've helped a lot of people with Medicare, and just getting things approved and getting things done. And well, this is the way we've always done it. This is the best treatment we found. But now you don't have to go with what has always worked, and you can go with what's working for others. That's my point. So this is exciting. Let's look at another change you may not have heard of. It says that it updates coverage policies for artificial hearts and vascular assisted devices. Now, we know everybody, you can get a pacemaker, you can get a stent, all these things to help with your cardio, your vascular system. But check this out. So they finalize updates, policies for artificial hearts and ventricular assisted devices, which are used to treat patients with life-threatening advanced heart failure. So until now, until January 1st, 2021, Medicare covered artificial hearts under coverage with advanced development. So that was a standard, right? And we know when you have a standard, that means that you work off the base. But now it's going to end that requirement for artificial hearts and instead allow for more standard coverage determination process where decisions are made by local Medicare administrative contractors, which just means when you have something that has a base, it has this is what we've always used, and you have to use from what we have on the shelf over here. Okay, your Medicare administrative contractor, your administration that's local to your region has found that this device is working instead. It kind of goes back to the first slide I showed you. Now we don't have to go through the evidence development. We're able to go ahead and say, let's do this. For example, now this is going to be a little out there, and I'm not saying this is what they're doing now, but let's just say they perfect 3D printing. Let's just say they perfect 3D printing. At one time, you would have to wait for a heart transplant. At one time, you'd have to have an artificial heart built at one time. Okay, this is my point, something off the shelf. Let's just say they perfect 3D printing at a vascular specialist hospital. And we know we see hospitals now built with a vascular wing, with a cancer wing. We see this if you're in a major city. Let's just say they perfect this. And they say, we've trialed this. This is working. We have made, vascular assisted devices right here on our 3D printer. Here's our test studies. We don't have to go through the lengthy process of waiting for the FDA to come through and do 10 years of studies. They're going, if they have enough clinical studies to show that this is working, then, and it's under that other MCTIS, then you're going to be able to get that taken care of now. And that is what is exciting. And that's what I'm talking about, is that with technology moving faster, it's going to zip out a lot of the red tape to get the care you need. That's what I'm saying. Medicare is becoming like the greatest insurance ever because it's moving along with the rest of what we need in the US, and that's quick care. Now, here's what everybody really wants to know. Okay, the 2021 Medicare Part A and Part B premiums and deductibles. So I'm going to get this out of the way because I have a couple of more things I wanted to share. Now, Medicare Part B, as you guys may not know if you're new to Medicare or you're still approaching the window, your IEP, your 7-month window to apply for Medicare. And again, if you have not done that, talk with one of us. We're going to be able to help you get started. And also, we're going to tell you what not to do. A lot of people always say, oh, you got to get your Medicare, you got to get your A and B, you got to do this, you got to do that. Well, really, it depends on you. Are you working? Are you on a group plan under your spouse's employer? Are you on a marketplace plan? Are you in a retirement benefit? Do you have teacher retirement that has healthcare as part of that retirement package? Are you on COBRA? There's a lot of things we want to know before we're going to tell you, oh, yeah, you need to apply right now. So that's why, yeah, I tell you, I cannot encourage it enough to talk with one of us because we understand that everybody is under a different scenario. And depending on that scenario, will determine what your next step is. Okay. A lot of people, of course, delay Social Security benefits because the full retirement is, I think, 67 and a half. And if you turn in your Medicare application to Social Security and you don't check the right box, you're going to initiate your retirement before you want to. And so that's why I tell you, we want to do it with you to make sure that we ask the right questions and we send in the right information. But when it comes to your Medicare premiums and deductibles, Medicare Part B, for those who are not too knowledgeable of what Medicare covers exactly. Part B is what covers your doctor, outpatient hospital, or inpatient services, your durable medical equipment, and other medical healthcare services not covered by A. So, for example, if you go in the hospital and there's a deductible, you go in the hospital, you just paid for your bed, and I'll show you Part A in a minute. All you did was cover your bed. When that doctor walks in the door, your Part B is activated. That doctor is paid for through Part B. So if he reads your chart or she reads your chart, that's Part B. When they take your blood pressure, that's Part B. When they take you down to the x-ray lab or the radiation or to draw blood and get a urinalysis on you, that's Part B. When they say you need surgery, that's Part B. Okay, do you understand? Part B is everything: inpatient, outpatient, doctor's offices. If they prescribe you a CPAP machine, that's Part B. You need a cane, that's Part B. You need ambulance services, that's Part B. So Part B covers everything except your room and board. So the standard monthly premium for Part B starting on January 1st, 2021 is $148.50. $148.50. Now understand this. Regardless of the plan you choose. Now, original Medicare is only A and B. Original Medicare is only A and B. It's not prescription drugs. It's just A and B. Not C, not D, not MedSup. It is Medicare A, Medicare B. That is original Medicare. Everyone has to enroll in Part A and B if they want a secondary plan. Now, is that going to be a Medicare supplement or a Medicare Advantage? We don't know. When we talk to you, we'll help you know. And remember, if I didn't mention this before, and I know I did, make sure you stay to the end because we have some gifts to give away. And I'll tell you how you're going to get those. So just hang with me here. Okay. So when you have Medicare, and when you decide that you want to enroll in a Medicare health plan, whether it be a Medicare prescription or a Medicare, not prescription, sorry, a Medicare Advantage or a Medicare supplement, you have to have Medicare A and B to do this. So your Part B premium, and everybody will pay it, will be $148.50. Now, let's say that you're someone who has a very fixed income, you're considering retiring, but you know that your retirement benefits are not going to be, or I mean, it's going to be a significantly reduction in income, and this is a bit much. This is quite a chunk of income out of your Social Security check. That's okay. There are programs to help you with your Part B premium, and we have access to those applications. You do too, but again, it's a little bit overwhelming. We want to help you. Okay, so there's state and federal programs to help with Medicare Part B premium. So if you feel like this is a bit steep, that's okay. Talk to one of us. We're going to help you get that application in. Okay. Now, there is a deductible for Part B services. So starting in January of every year, Medicare will, give you the new premium amount, and then they say, here's your Part B deductible. Now, for Part B, once you pay the deductible, which is $203, Medicare pays 80% of all approved services, and then you're responsible for the 20% left over. Now, 20% can be a whole lot if you are admitted to the hospital and you have, let's say, appendicitis, and you have to have surgery. Now that right there is about $130,000, 20%. So that is why people get secondary plans. And we'll talk about those later on in a different video, because right now I'm focused on the changes. But the Part B deductible is $203. And that's about $5 more than it was last year. So if you're new to Medicare, the rates did not go up very much. That's $203. It's $5 more than 2020. The 148.50 went up $3.90, which again is very affordable considering in previous years, if I mentioned before, we saw those premiums jumped by about $19 to $26 from one year to the next. That's a steep jump. This year it was very mild. But again, if you're on a heavy fixed income, there are programs to help, and we want to help you get access to those. So be sure to call us. Now, Medicare Part A is your inpatient, hospital, skilled nursing, and home health, like hospice or just home health in general. So if you are admitted in the hospital, and let's say you're there for a few weeks to a month, after that, they usually transition you into skilled nursing. And skilled nursing is you have a nurse there, but you're really kind of independently doing things. You don't need the medical care that you had in the hospital. You're not on any kind of machines or care like that, but you're going through that rehabilitative state because now your next step is to go home. So you're kind of getting your strength back, back to independent functioning, showering on your own and whatnot. So that's what skilled nursing is. And then the next step is home. And when you go home, sometimes they will send a nurse home to you. I'm not talking about someone who comes in and is a provider. A provider will help with running errands for you, picking up prescriptions, moving things around the house for you to be mobile. That's a provider. A nurse will come in, and that's home health. When a nurse comes to the home, that's paid for by Medicare. Providers are not. Okay, there's a very big difference between those, and we'll help you understand that when we have a conversation with you. But home health services, a nurse comes in the home a couple days a week, sometimes every day, depends. And they're only there to make sure your medications are good, maybe to clean out wounds, if it's wound care. Maybe it's occupational therapist. It could be, gosh, there's so many things that that nurse could be assigned to do, and it's for a short period of time. That's covered under Part A. Now, under Part A, whenever you are admitted into the hospital, okay, there's going to be your deductible is $1,484. That's for you to get into the hospital. That's what you pay for your bed. So under Medicare Part A, that's your deductible. Now, we'll say this, it's not an annual deductible. It is a per admission deductible. If you go in the hospital this month for any reason, this is what you're going to pay. If you go back in the hospital, if you're discharged and you go back within 60 days for the same reason, then that deductible is waived. But if you go into the hospital regardless, 60 days or more, for any other reason, it's under a different code. Remember I mentioned code earlier? You're going to have to pay that deductible again. So if you went in the hospital under code A and you were discharged and then something happened, you had a repercussion, you got to go back under the hospital under code A. Don't confuse it with Part A. Code A, under the Medicare coding, that deductible is waived. Now, if you are discharged and you go back in the hospital for code F, whatever that would be with Medicare, let's just say code F, you're going to pay that deductible. And then if you get out and you go back in the hospital for another reason, code M, you're going to pay this deductible again. This is why I cannot emphasize enough. When you are approaching Medicare, you always want to be sure that you have a secondary plan with original Medicare, because that's going to help with these deductibles. Because can we determine how many times you're going to go in the hospital? No. You know, we always hear it as we get older. We're kind of like cars. You fix the alternator, and then the timing belt goes out, and then you fix the radiator, and then you got to fix the air conditioner, especially if you live in Houston. So our bodies are kind of like cars. We can't predict how many times we're going to visit the hospital and for what reasons. So we want to protect you from those. But this is the Part A deductible. And I really encourage you guys to learn how Medicare works. And you don't have to read the Medicare New Handbook. You can actually, we have a guide, and I'll talk to you about that at the end of this webinar, how to get that guide where you can really understand original Medicare and why it's important to have a secondary plan. And, second to none, we want to talk to you because we can much better explain it and answer questions as you're learning. The best way to learn is to answer and ask questions. Now, this is a huge change, guys. This is huge. I know we have seen a lot of news in the past few years of how people cannot afford insulin. And it's sad because for some people without their insulin, they're just not going to make it to the end of the day. It's a fact. People, if they don't get the right medicine in their bodies to regulate their blood sugars, they're going to spike. They're going to end up in the hospital. They're going to end up sick. They're going to end up amputated, whatever. They're going to end up dead. So one of the greatest things we have seen, and I don't want to say one thing is more important than the other, but this is very important because it affects millions of Americans. The new insulin benefit. So with Medicare Advantage or private Medicare health plans, which would include Medicare Part D. Okay, remember, original Medicare does not include drug plans. When you get original Medicare, you need to select a drug plan, and you can do that. If you get a Med Sup, you get a standalone drug plan, or if you get a Medicare Advantage, in most cases, the prescription drugs is bundled into that Part C plan, and that's when you talk to one of us, we'll help explain the difference. But my point is that the copay now monthly for insulin is $35. $35. That is, I mean, you talk about wiping your forehead and feeling so relieved. If you've ever been in an airplane and it loses that, what do you call it, whenever you drop like 5,000 feet in the air and then the airplane stabilizes again. I can't think of the word right now, but that feeling. Well, whenever it's all over with and you wipe your forehead, you're like, oh, okay. When you hit an air pocket, well, that's what this movement with Medicare did. It gave such relief to so many people who are dependent on a life needed, a survival drug. And here we are getting it for $35 a month. That is historic. I mean, historic. And so if you are on insulin, or if you're pre-diabetic and your doctor is saying, hey, get it under control, or else, this is something that is good to know. Now, if you are on a fixed income, I'm going to address this again. There are programs that will make this prescription a third of that cost. And again, we know how to help you get that benefit. If we will screen to help make sure that you qualify for it. And we're going to submit that application with you to Social Security. Believe it or not, it's not to the health plan or to Medicare. It's through Social Security. And if you do qualify, then you will know in less than, usually it takes 10 to 17 days to get the confirmation of whether you are or not approved. We don't approve you, of course, Social Security will, but we help you with that application process. So if you are on a fixed income and this is a concern, even though this is a historic low cost to insulin, we recognize that many people are still on very fixed incomes. That's okay. There are programs that we're going to help you get that information, get that application in, and your insulin will be a third of this cost. And so we want to, I just want to let you know that we can help you with that. But this is awesome. So, and if you haven't heard of it, I'm glad to tell you it. Now, end-stage renal disease. This is another big one, and I've been talking a lot about this. It's known as ESRD. When someone says, "Hey, do you have ESRD?" They're saying end-stage renal disease. Now, if you didn't know what ESRD was, you do now. And so, a lot of people whenever you are under the age of 65, if you have end-stage renal disease or ALS, those are quick triggers to activate Medicare almost immediately. ALS, I think, is within a month of diagnosis. With end-stage renal disease, after your fourth dialysis, your fourth month of dialysis, then your Medicare will become activated. And with disability, it's 24 months. So you can see there's a big difference in getting that benefit started right away if you have ESRD or if you had ALS versus disability. For those who had end-stage renal disease under the age of 65, with Medicare, you were only able to remain on original Medicare. And I talked a little bit about how expensive that is. You would be allowed to opt into a Plan A, a Medicare Supplement Plan A. Just so you have an idea, a Medicare Plan A, Medicare Supplement Plan A, not Part A, Plan A, is the most expensive Medicare supplement that is marketed. And ironically, it has the least coverage benefits. It covers less than any of the other Medicare supplement plans like G or N, C. The Medicare Plan A covered the least of Medicare approved services, and it was the most expensive premium wise. But that was the only option for people under the age of 65. You could not enroll in a Medicare Advantage plan if you have end-stage renal disease. Now, for those who have Medicare because of disability and they develop end-stage renal disease later, the plan doesn't kick them out, but they weren't able to change plans because that was a kick-out question. You were kind of locked in. So for a quick story, I had someone I know who turned 65. They weren't on disability. They turned 65 and they enrolled in a plan in 2010. In 2014, this individual was diagnosed with ESRD. Since 2014, this individual has never been allowed to change plans because no plan allows you to enroll if you have existing end-stage renal disease. And so this person has been stuck in that particular plan with all the changes it's gone through for the last 6 years with no options. Well, now that this rule changed on January 1st, 2021, that individual can now change and shop any Medicare Advantage plan they want. Now, I'm talking to you if you're under the age of 65. If you have end-stage renal disease and you had Medicare Plan A, and when you turned 65, of course, at age 65, you are able to go into any Medicare supplement plan within 6 months of your 65th birthday. I'm going to repeat that. If you have end-stage renal disease and you're under the age of 65, but you're turning 65, you have 6 months to enroll in any Medicare supplement plan of your choice without any health questions, which is great. But if you are not turning 65 and you have end-stage renal disease and you have been locked into a Plan A, or you can always disenroll, but you'll just be on original Medicare at that point, you have the opportunity come next annual election period, unless you have another special election period. And I know this, if you're not on Medicare, making these things make sense, special election period and all that. That's why it's good to talk with one of us whenever you are learning about original Medicare. There's a lot of things to know, and we want to break that down for you easily. But if you are under the age of 65 and you've been locked into a Medicare Supplement Plan A, you now can move into any Medicare Advantage plan under the age of 65 with end-stage renal disease because this question is no longer valid. So that is big news for people who have gone or is going through this. There's changes, and it's to get you better access and more affordable healthcare. The whole point of these changes to Medicare is to advance and expedite your access to care, to advance and expedite your access to innovative things that are coming out, and not wait for it to only be used with people on private insurance, but now you can use it on the Medicare side. That's so phenomenal. And again, to make it affordable. Let me see what else I have here. Okay, so CMS announces innovative payment model to improve care, lower costs for cancer patients. Wow. Check this out. So CMS finalized a new innovation center. I'm just reading off the screen here. The quality of care for cancer patients receiving, and this is so huge. This has to do with the hospital transparency, which means that the price of one hospital to the next, they have to be able to give you that information up front. But just check this out. Patients receiving radiotherapy and reduced Medicare expenditures through bundled payments that allow providers to focus on delivering high quality treatments. So it allows them to focus on value-based care by creating simpler, more predictable payments and to incentivize cost-efficient, clinically effective treatments to improve quality. Basically, before, let me see if it shows it here. Yeah, here's how it is. When you were on a fee-for-service payment structure, I know people who, regardless if they're on original Medicare or in a Part C plan, if they had to have a copay for their Medicare, not Medicare, for the radiation treatments or for diagnostic testing, they had a copay per test, per radiation treatment if you're on original fee-for-service, or if you have a copay style Medicare health plan, usually typically with the Part C plans, they had to pay per visit, a copay per visit. So now what this has done is it's bundling treatment. So if you had, let's say you had stage 1 throat cancer and you're going to have to receive 9 rounds of radiation and you'd have to pay a copay or 20% per round. Now they bundled it to just one, which means you're going to pay 20% one time or a copayment one time. That is huge. Huge, I tell you. So Medicare pays providers and suppliers for each individual service they perform. Additionally, Medicare pays differently for radiotherapy depending on where you receive it. And with that saying that, some people get radiation treatments in their hospital setting because their doctor doesn't have that equipment locally in their office, or that patient may go to an outpatient facility that's freestanding, okay? Kind of like x-ray places. There's imaging and radiation. You have it at the hospital or a freestanding building. So they would differentiate the payment, but the differences in payment rates can incentivize Medicare providers and suppliers to deliver radiotherapy over more visits. What's that saying? The doctor's looking at you and saying, well, I can spread this out with 20 radiation therapy and I get a percentage, 20%. I get my cut 20 times. And if I send them in the hospital, that'll increase payment to the office. So let's do it that way. That's terrible to think that that would happen, but that is a fact of the matter. Well, this erased that. It's eradicated. It's gone. Medicare providers and suppliers would deliver radiotherapy with more visits in one setting over another, which can result in extra costs to the beneficiaries. I mean, I don't think I have a slide after this because I was going to talk over it. Yeah. So what they did was that now they're going to bundle it. So the RA model, part of the final rule on specialty care models issued that beginning on January 1st, 2021, it is estimated to save Medicare $230 million over the next 5 years. And because they're bundling it, it's going to reduce copays to you. It's going to reduce visits. It's going to reduce, and it's not reducing needed visits, not that at all. Don't think that. It's reducing, it's making things where if the doctor is going to receive the same payment, regardless of how much radiation or radiotherapy treatments or diagnostic treatments or outpatient treatments that you're going to receive, if it prevents them from spreading out to receive more payments from a copay or the 20% and 80% that Medicare pays, if they're going to get paid the same for doing less, not less care, less strung out, then that's going to save you money and time, and it's going to incentivize them to give you better treatment. Now, why is it important that it saves Medicare $230 million? Because just like with these premiums we saw this year from 2020 to 2021, it was a $3.90 difference. It significantly reduced the premium payments for you and the deductible, and that's big. Now, a couple of things I didn't put on a slide for you guys. Telehealth. Telehealth has been a big initiative. Now we know that it started around 2018. It kind of started a little bit. We started hearing about it. Of course, if you had a group health plan, telehealth was already kind of hitting the scene, but with Medicare, it was not. Now with the during the pandemic, it expedited a lot of things, but a lot of things can just be trialed at local offices, but now it is part of the Medicare program. the CMS program. So it's now an act. It's now part of what you receive when you enroll in Medicare is telehealth. And this is big because I mean, think about veterans. Now, their access to care has really improved in the last few years. Okay, there's more standalone clinics for veterans to go to. But if a veteran had an earache and they received all their healthcare services at the VA, you don't want to go sit in the VA for multiple hours to get your ear looked at. You want to go to a local doctor, but then the out-of-pocket cost was fairly high for them. So with telehealth, they can telehealth into the VA and say, this is my ear. It's kind of swelling up on my throat a little bit. It hurts when I swallow. Okay, let me call you in a prescription. We'll have you come pick it up at the pharmacy at the VA. That is telehealth. For us who are non-VAs, and I was using them as an example because going and sitting in, same thing. You can call your primary care doctor and say, I've really got a lot of indigestion. I've got a lot of bloating and gas, and it's very painful. I'm not sure if I should come in. They're going to ask you, do this, do that. So let's rule out if it's anything we think is major. And they're going to send a prescription to the pharmacy. You go pick it up. You don't have to sit uncomfortably in the doctor's office for 3, 4, 5 hours. Now, what about those who don't have technology? Well, I think they found a solution for that. Recently, someone I know who has no technology, none, buys minutes to put on his flip phone. He received a tablet in the mail. And he's like, I don't know what, they sent me some computer. It's just a tablet. And I called his health plan. I said, hey, he received a tablet. Does this come from you guys? And they're like, yes, that's for him to have telehealth services with his doctor. All he has to do is turn it on. I said, well, he doesn't have Wi-Fi. And they said, oh, he doesn't need to. It'll bounce off of any tower closest to him. So he just turns it on and then he pushes a button and boom, it calls his doctor's office on a special machine. And now they're having a teleconference over him. And that is so awesome. And this all came in because of the changes to Medicare, the expediting and reducing the paperwork, expediting the access to certain treatments. And then again, by doing all this and with new technology, it's reducing payments. You wouldn't think it, but it does. Now, I did tell you this. If you stayed with me, that we do have some giveaways. First of all, I want to tell you a quick story. I don't know. Nod your head. Raise your hand if you like stories. I won't make it a long story. I wish I had jokes. I really don't have any jokes anymore. I remember I used to tell jokes as a kid. Did you guys tell jokes? Always, right? I get Reader's Digest, and I don't know if you guys get Reader's Digest. I get Reader's Digest in my email, and it says the best jokes here. And I always star it to go back and read, but I never take the time to go back and read. I need to learn some jokes for entertainment. But I want to tell you guys a quick story. We have giveaways. Now, I'm going to tell you how to get those giveaways because you stayed in with me. But I want to tell you a quick story because one of the giveaways has to do with this story. The principal of our company, Michael Wilhelm, he's a veteran. He is a Medicare beneficiary, and he is part of the sandwich generation. Well, I don't know. Can he be considered sandwich? His daughter is my age, but he is on Medicare, and his mother is on Medicare. Again, he's a veteran. And he's a client to TSS, to his own company. Okay. A few years ago, about, I want to say, gosh, I think it was 11 or 12, maybe 14 years ago, somewhere in there. Somebody had an emergency room visit. When protecting HIPAA and all the good stuff, I'm not going to go into those kind of details because I cannot, but they had an emergency room visit. Now we know that we can go to the emergency room for any kind of reason. And this individual who went in the emergency room is allergic to a medication that emergency room doctor nearly injected this person with. Okay, so I'm going to say that again. Person goes in the emergency room, and the emergency room doctor was about to inject this person with a medication that this person would have died from. Thank goodness that this person stopped that injection, pointed to their purse, and pointed quickly. Inside of there was a piece of paper that says, highly allergic to this medicine. Will die. that inspired something that was created that we give people who join our webinars or become opt into our Facebook pages, and they go through some of the Facebook lives that I have there. You call in and we'll get this chart to you. It's called the Emergency Medical Health Chart. This thing is key. It's just a paper that we have certain criteria where you fill in, and you keep a copy on you and you give a copy to someone who helps you, or you put it on your refrigerator in case you have an emergency in your home, and on there there's a contact number and a list of the medications you are allergic to. Because if you are in an emergency situation and you are not audible or you are unconscious, whoever they need to get a hold of, they need that person who takes you in, unless you're in a car accident and there's nobody around you. You can put it in your wallet in front of your driver's license because they're going to pull through that. This is going to save your life. It can save your life. And I'm allergic to bees. I'm allergic to bees, and I don't know what happened. I think one came in on one of my very hairy doggies, and the other day I was on the floor and I was trying to swoop something out from underneath the TV cabinet, and I have wood floors, so it's not carpet, and I rolled my hand over something and I felt fire shooting up to my elbow. And I was actually on the phone with a coworker when this happened, and I freaked out. And I was like, it's fire, it's fire, it's fire. But my hand, and when I pulled my hand up, there was a bee in the palm of my hand stinging me. And so naturally my hand swelled up and my arm swelled up. Now let's just say that I am very allergic to that, where I go into anaphylactic shock. Thank goodness I don't. But let's just say it would be very, very important that someone who took me to the hospital, or when the paramedics came, I point and I said, I'm allergic to this, I'm allergic to that. And they would know right away not to give me something that could harm me and definitely send me into an admission versus a treatment. Okay, get my point. That's one of our free gifts. The other thing that whenever you do call, like I said, we have giveaways. And when you call in, you're just going to say, Sondra said to call for my free review. I told you earlier in this webinar that everybody has a different scenario. You might be on COBRA, a group health plan, TRS, which is teacher retirement. You might be on a spouse's retirement. You might be a marketplace. You may not have all of your Part A quarters yet. What do you do now? What if you worked and you didn't pay taxes for the 10 creditable years? What do? We know how to get you to the next step. That's why you need to call and talk with us. So your review is free and, of course, without obligation, but you need to know where you stand. And then that way you know how to make the right next step. So make sure Sondra said, I need my free review. And the biggest thing that we want to give you is the changes to Medicare guide. And the changes is going to talk about what took place for 2021. It won't have all this information in there, but it's going to have the ones that affect you right now. And again, that's going to be, we're going to talk to you more about the premium and the deductibles and just other things that are important. And one other thing that we have, and it's, we're finalizing it now. A lot of you folks, when you turn 65 and you enroll with Medicare, you're going to receive something that's called the Medicare and You Handbook. It's distributed by Social Security. It's great. It's a book, but I always describe it as the old white pages. You know, and if you're, I know where I am. I'm in my 40s, but if you're older than me, I know you know what a white pages is. It's a little thick, and so they send you this Medicare and You Handbook, and it covers all the subjects of Medicare. Do you need all that information? Most likely you're not in every situation, so no. We have we took that same book and we kind of broke it down into great compartments, and it's called the Medicare. Oh my goodness, I just forgot the name of my own book. um, That's Medicare and You Guide. All right, give me a second. But either way, we have a more simple version. Everything is included, but it's compartmentalized and it's broken down for you. The New to Medicare Guide. Thank you. It's the New to Medicare Guide. And we have that. We're finalizing it now. And that's what we send to you digitally. And that way you can flip to where you are in the Medicare process, what pertains to you, without having to go through an entire guide and read about things that don't apply, because that's how Medicare becomes overwhelming. Medicare is a great program, folks. It's one of the greatest insurances out there. If you're still in a group plan and you're toggling between original Medicare and getting a group, staying on a group health plan, we're going to ask you a few questions. We're going to talk to you about premium versus premium, deductible versus deductible. We're going to talk, we're not saying that you should get off your group plan and move into Medicare, but what we're going to talk to you about is overall cost and when will be the right time to transition to Medicare. A lot of people in group health plans may enroll in Part A and delay Part B. But what do you need to know if you're going to do that? There are things you need to know so then you can prevent what is called a late enrollment penalty. So those are things that we're going to talk to you about, and that's why we cannot emphasize enough to always do. We want to do Medicare with you. It should never be a DIY. This isn't going to be my wrap out. I hope that you gain some great information. I hope you are excited. I know insurance is not an exciting topic, but when you're looking at a healthcare program that's going to take care of you until the end of days, people are living longer, folks. I mean, we have grandparents that are in their 90s. We hear people living to be 105. With technology and innovation, people are living longer. So when we talk about insurance and what Medicare is doing, we get excited because we know this is going to be the health plan, or at least the industry that's going to take care of you for the next 30, 40 years. And these changes is just going to make it better. Access to care, being able to use the most innovative interventions and tools and mechanisms and devices with same day approval. Come on. This is not like your grandparents' insurance. This is so much better. And we're excited to be able to give you this information. And so, again, make sure that when you call in, okay, that you definitely get that, ask about the changes to Medicare. We will send you the new to Medicare guide, which is a simplified version of the Medicare New Handbook, and we're going to get you that emergency health chart, and we have some other. So thank you for joining me. Sondra Ford, Trusted Senior Specialist. Everyone have a wonderful and great day and a good, happy, great new year. Thank you all.